Hello, everyone, and welcome to the Black Women Works podcast, HeadWraps. Black Women Work began as an online space for Black women to share challenges and successes, an affirming space for us to love on each other, express ourselves, and cheer each other on as we are navigating through so much: families, children, partners, spouses, careers, dynamics around both race and gender, all while trying to live our best lives. We decided to take our talents to podcasting and created HeadWraps, powered by Black Women Work. We're so excited to share this episode with you on women's health and our first episode with a guest. So we're excited that you joined us, and we thank you for that. I am Michelle Felder, bourbon lover, entrepreneur, supporter of all things Black, and I love this space. And I'm going to pass it on to fellow co-founder Keisha Chambers.
Hi, everybody. Thank you for joining us today. I am a wife, an engineering project manager, an entrepreneur, a traveler. I am a Black fiction reader and a lover of red wine. And I'll pass it to Valisa Howard.
My name is Valisa Turner Howard, and I am a wife, a mother, a lawyer, a civic leader, and a believer that this space is much needed for Black women. My final co-founder, Erica Merritt.
Saving the best for last. I'm Erica Merritt. I am a wife, a mother, an entrepreneur, a lover of science fiction, and a fierce advocate for racial justice. And I'm super excited for this conversation today.
Awesome. So now, as I share, we have first podcast with a guest, and I'm going to bring on Dr. Joi Robinson Tidmore to help us and guide us through this conversation on women's health. So Dr. Joi Robinson Tidmore has joined us on our podcast. Thank you, and hi, and welcome. Joi is a doctor of obstetrics and gynecology with Lake Health Medical Systems, and we welcome you to the conversation. Joi, do you want to tell the audience a little bit about yourself?
Sure. Thank you for inviting me. Again, I'm Joi. You can just call me Joi. And I have been practicing OB/GYN for 20 years or so. I am a native of Birmingham, Alabama, and I moved here about 20 years ago and have been with University Hospitals and recently with Lake Health. I have 3 kids and a recent graduate from high school. So it's been an exciting weekend. And so that's pretty, that's one right there.
There's one of them.
Trying to sneak by.
Sorry about that.
No.
Yes.
So in full disclosure to the audience, Joi is my fabulous OB/GYN. She's only handled the GYN part because I am not having any babies. It's a debate amongst us, but not doing it.
I keep trying.
She keeps trying. She was trying just the other week at her house. Nope. So just wanted the audience to know that. So we're going to just dive right in. There's quite a few questions that women have that we want to talk and pitch to you and see if you can give us some guidance. So Keisha, Valisa, and Erica will be tossing some questions, and I will as well. Keisha, do you want to lead out with your question about that big thing that we all are kind of waiting to happen?
Right. Oh, Joi, I wonder if you can guess what this question is going to be about.
Oh, yeah.
Oh, yeah. Yeah, this is the big M question.
The M question.
The M question, yes. So what should we be doing to prepare our bodies for menopause? I'm not there, and I don't even think I'm in peri, but what are some of the signs to know if you are at that stage? And then what should I be doing to just make sure I'm in the best health or, the best shape I can be in entering into that phase of life?
So So, that's a $1 million question, actually. Menopause is something that we don't often spend a lot of time talking about because everybody's menopause or perimenopause is different and starts at different times, and everybody has different symptoms. But if we are lucky, we will get there and we will be menopausal, and all of a sudden your life will change. So I have spoken about this many years, prior to me entering menopause, and now I can speak from experience. It is no joke. So I don't know where to start with how to prepare yourself for it, except for to, try your best to maintain and be healthy from the beginning. If you have a healthy, balanced diet, if you incorporated exercise into your life space before you even get to 40s, 45, that definitely helps. There are some physiologic things that will happen that we can try to head off, but there are some things that you just really can't prepare yourself for without doing those steps, along the way. So in other words, you can't say, okay, I'm starting to have hot flashes, so I need to start doing this. You have to have those types of, taking those types of steps prior to. So common symptoms prior to menopause. Menopause is actually clinically defined as 12 consecutive months without a period, if you still get a period, or if your doctor is checking your blood work, your FSH or follicle stimulating hormone levels are above 20 persistently. So that's where you'd have, be diagnosed with menopause. But prior to then, the perimenopause can start anywhere between 40 to 50, and every woman is going to be a little different. Most common symptoms are hot flashes, night sweats, but some other subtle things can go on too, particularly memory things. You may start to feel like you have a little brain fog, like you can't remember common words that you used to, say in regular conversation. Waxing and waning of your mood. You may have some mood instabilities, but you have to also remember menopause usually comes at a time where a lot of us have other things on our plates. We have jobs and family responsibilities, and you may be sandwiched between dealing with elderly parents at the same time. So, naturally your moods can be a little bit unstable then too, but you can often see that. And then there's that big other M thing called metabolism. It really starts to just come to a grinding halt. And so that's where you can really, prior to starting to see a lot of clinical things, start to kind of boost that metabolism by exercising, eating a healthy, balanced diet, meaning less carbs, higher protein, and making that part of your routine. So that's how I would prepare.
Okay, but it's coming.
It's going to come. It's going to come. And there's some other just general things that if you start before learning how to meditate and have a routine for just ones that like breakfast. That's another one of the children. I'm sorry. If you can have a routine for meditation and relaxation, find some hobbies and things that you enjoy doing and start, making those a part of your life. That would be great.
So is the way that we experience this, is it environmental, genetics? Are there any leading things that cause women to, because I know we experience it differently, we enter into it differently at different times or ages, but are those things mostly genetically driven, or is it environmental factors that also play a part in it? Or why moms and daughters may experience it drastically differently and things like that?
I think a lot of it depends on your basic physiology. You can definitely see patterns in families, like your mom or your sister may have had these types of things, but you can also see dramatically different patterns of menopause within families too. So I think the real explanation is go back to when you started your period. So this is coming down the mountain, but going up the mountain when you started your period. You may have experienced something completely different than your sister or your mom may have. So those hormones are very, very powerful. And removing them, whether gradually or more abruptly, can affect you, definitely differently. So I don't think there's specific patterns or anything genetic. I think it's just about your metabolism and where you're starting from. So if you put yourself in a healthier state prior to your 40s or right around between 40 to 45, you may experience a little bit improved symptoms or be better able to manage those symptoms as you go through menopause.
Excellent. I think that's a great segue, actually, Keisha, into your second question about body mass index. If you want to
right.
throw
So
that out.
that is definitely one part of my discussion with my friends as we're all getting to this point or have already crossed into this point, is that your body changes. You hold weight differently.
Mhm.
And that led me to thinking just about when you go to the doctor and they do your BMI. And I've heard that the way BMI, how they determine that, can be different based on if you're white male, white female, Black woman, Black male. So one, I was wondering what is kind of like the range of proper healthy BMI for Black women? And is there a way that we can begin to start tracking that in the best way to also reduce our body fat leading into the big M and even during?
So, this idea of body mass index can be very daunting to a lot of people because they're looking at perhaps a chart or a graph that's on the internet and, calculating, plugging their numbers into it and get a number that's, may not be exactly what they're looking for, something shocking. But you do, like you said, have to differentiate a little bit more about where you fit in this body BMI. And that's where genetics come in. It's no secret, Black women are built differently for the most part. Their makeup is different than Asian women, Caucasian women. And the BMI, the way you calculate, if you actually went and got your body fat calculated, would be distributed differently. So those are the things you have to actually think about when you are looking at hard numbers. So I would never say you have to be within this BMI. I say you have to be within a healthy weight, and everybody's healthy weight may be different because your weight distribution may be different. But when you look at that, plus your cholesterol levels, your blood glucose levels, your cortisol levels, those are the things that really come together to help project healthy weight and healthy living. It's not just the BMI. So 5'4" woman, should have a BMI somewhere around 26, 27. Now that could be really small for someone who's genetically hippie girl or, may have, more curves, but it doesn't mean that you're unhealthy. You can be healthy with a higher BMI if you're controlling your life and your diet in other ways.
Great. So Keisha, you brought in the specifics of Black women, and Valisa has some questions geared towards, and since we are a podcast and a business all about Black women, Valisa, do you want to pose one of those questions to Joi?
Sure. So I'll start with a larger question, and that is, how does racism impact Black women's health?
How much time do you have?
Yeah.
Good answer.
Not a lot, but I'd love to hear your perspective on this because I know that many of your patients are Black women, and so you probably see some of this happening.
Absolutely. I really feel that Black women come to the table with a lot more in general. So, part of being an OBGYN is doing OBGYN. The other part is almost being a psychiatrist. Sometimes you're sitting and you're listening to Black women speak, and you understand as a Black woman what you're going through. So say, for instance, you have a patient who has had to cancel an appointment 2 or 3 times. They cancel the appointment, they make it, they cancel again, they make it. And your medical assistant or your nurse manager says, well, they've canceled 4 times. We need to just X them out of the practice. We need to cancel them from the practice. Well, that's when you take a step back and say, well, why are you canceling these appointments? Give them a call and see. This just happened to me a couple of weeks ago. Well, this particular mom had issues where she couldn't pick up her children and get them there on time. She did call every time and she canceled the appointments. When I finally got her there to see her, she had real medical issues that needed to be addressed. So if you didn't have a person who was sensitive to the struggle, basically, that we have different issues. And if you didn't have a person that's sensitive to those issues, that patient would have walked out the door, never even maybe gotten into your room to be seen. So that's just one big overview when it comes to how we are perceived. If we're late or if we cancel appointments, then we're just inconsiderate and lazy, and it may not actually be the case. And I think that just our presentation, just knowing who we are and our circumstances, if we just take the time to listen to people as we're treating their health, then we can actually open up and find out that, we may have some differences, but it's not, shouldn't impact whether or not you treat me, as a patient, whether or not you're able to sit and listen to me and answer my questions and take your time with me. So racism is a part of our lives. It's a part of our fabric as Black women. We know historically, particularly in obstetrics, we were experimented on back when we had no power, no say. And I think still now our voice is not heard. Black women have higher mortality and morbidity rates when it comes to childbearing, and we know that. And that's because we don't get our questions answered. And I tell women now all the time, you have to be an advocate for yourself and make sure people are listening to you, respectfully listening to you. And when your doctor is not, then you find one that is. And that's because I don't think we can change the way people feel about us as Black women, but we can change how we are perceived in the world. And that's by opening our mouths and having a voice.
I remember, you probably remember, but maybe not. So Joi performed a surgery on me, and right before pre-surgery, I questioned the anesthesiologist, who was very cute, by the way. And I asked him, do you feel Black people and this Black person experience pain the same way others? And he looked, and I looked, I kept a serious look, and he answered, he says, why, yes. And I said, okay, I want you to put me under like you would if I was your mom. And I don't know if Joi, if you were in the room at that time, I kind of think you might've been, but nevertheless, I said, I'm going to embarrass her, but I had to ask the question because that was a whole ordeal for me. So I do agree. And I think that's good to think about. Now, Erica is our resident DEI, all things making equity and space for Black voices and marginalized people, she would say. So I know you have something to weigh in or a question to ask around this race and intersection with healthcare and Black women. So have at it, girl.
Yeah, hi, Dr. Joi. I am wondering, and I've got a client whose focus is healthcare, and we've been having some really interesting conversations about, from a behavioral health perspective, how do you treat racialized trauma? So I'm curious, one, if you have any thoughts about that, and then what are things we want to end racism. I don't know that that's something we're going to see in our lifetime. So what are some of the things that we can be doing to counteract the impact that we know racism is having on our health?
Mhm. So from a clinician perspective, this is one thing, because I see, women of all ages, and I've noticed that Black women, young Black women particularly, are often over sensualized just because we're Black and we're built differently. You'll have a 15-year-old Caucasian or Asian person and against a 15-year-old Black person, and men will perceive them differently. And so one thing I stress when I have a mom bring their teenager in is to talk to them about how they present themselves, not in a judgment way, but because I know they're going to be looked upon differently, and to help them understand the value of their body and the value of what is valuable to them, which is their body and their lives. So I spend a lot of time with my teenagers and young women, trying to help them explore their own self-worth. And once you do that, I think you can impact the way racism will impact you in your health, because you feel like you're valued. So when you're experiencing racialized trauma, oftentimes I think some women don't even recognize it as racialized trauma. But once you learn your value and understand your value and your place, then you can recognize that and address it. But that has to start young. That has to start young. And then that moves on into let's go to the maybe middle-aged woman who is either single or raising kids or whatever. You're now dealing with your health and your stress in the workplace, or things that may be impacting you in a racial way in the workplace, but you need this job. All these things, these social factors come into play, but they have an impact on your health. Again, going back to bringing your best you to the table, meaning you go out there and get every possible advancement you have to put yourself in the best opportunity to succeed. If you have a passion for something, then you work hard at it and get to the highest level, because that way you can't really have anybody take that from you. Again, knowing your self-worth. And I think that's what it comes down to. And the other thing I think we've kind of gotten a little bit away from as Black women is sharing. We used to call it testimony, we used to call it that, but just, being in the group of women that you can confide in and trust, and whose opinions you trust. And I think it's always important to have friends at different stages in life. Have friends older than you, have women younger than you, and your own peers, because you can learn a lot about this struggle when it comes to racialized trauma and just trauma as life as a Black woman, and how that affects your health. If you're stressed, you don't eat well. If you don't have the job you want, you don't eat well. You don't exercise, you have the impact of stress in your life that will come, as far as, heart disease, mental health, and those types of things. So sharing, knowing your worth, and just striving for the highest that you can, I think is the basic ways, I think, to impact racialized trauma when it comes to your overall health as a Black woman. That's where I start anyway.
So you helped me kind of turn the corner a little bit, because I'm going to do a shift, maybe a hard right, but we're talking about some heavy topics, and bring a little, and I know that self-care and joy and things of that nature are all of, oh, your name is Joy too, are all a part of our, our wellness. So I'm going to cut into a little more of the women's and gynecological space and ask you, on the topic of self-care and joy, how important are orgasms for women to experience in our self-care and our health and our wellness? I'm sorry, is there a child in your book?
No,
okay. You gave that look like,
I was like, oh, where is she? Well, I think that's an important part. I mean, I think women have been able to enjoy that, and that's a part of who we are. And I think it's important to experience that, but in a healthy way. Okay, I think it's not just a physical thing, it is also a very spiritual experience. It could be a very mentally rewarding or thing as well. So I think experiencing an orgasm is, great to have in the right situation. But that's part of self-care that you can manage with someone you love or someone or by yourself. And I think that's important to embrace that. And it's absolutely healthy and for your mind and your body and your overall care. I think it's great.
And do you have any just some, I don't want to say tips, but well, who knows? We don't know who the audience is or who's listening or watching, but any ways in which women, some things that you would suggest for us in taking care of our bodies and making sure that we're maintaining safety during our sexual encounters and with our partners. I'm sure you're going to like list like condoms and things like that, but if you could tell us ways in which we can make sure that we are keeping safe when we are engaging in sexual activity with others.
Well, I think, again, the first thing is to understand, where you are, who you're with, and being in the safest environment. No matter how you, get into the situation or if you're engaging, make sure that you understand that you need to be safe, not just sexually, but physically as well. And that sex should always be consensual. I mean, period. That's just the way it is. So if you're not in that space, or if you're feeling that this type of intimacy is forced in any way, whether it's, not just physically forced, or if if there's financial obligations tied to it, or if you feel that, you are obligated in any other way, then that's not healthy intimacy. And so obviously safe sex, that's a whole topic we've heard about since we were, knew about sex. So, I mean, I don't have to really go into that except for just be smart about it, just be smart about who you, engage with in that way, because it does impact your mental health when you are engaging in unhealthy sexual relationships. And I think that you run the risk of repeating those types of situations when your mental health is not healthy as well. So I think that's important.
Anyone else have another question before I have another one too, but another question. I have a question.
I do actually. One of my observations is, so I came of age in the 90s, and when I think about, for example, how often HIV was a topic of conversation as I was growing up in comparison to now in 2021, you just don't hear about it very much, but it hasn't gone away. Right. And so I wonder about that. It feels like sometimes when I talk to young people, there are a lot of misconceptions about the idea that there is a cure, and their evidence is often Magic Johnson, and there's all of this sort of misinformation. So I wonder, do you hear that in your practice? Is it that I'm old and I'm just not in those spaces anymore and the conversations are happening? I wonder about that.
It really is kind of interesting that, women will come in and ask for STD screening. And I say, well, I'm going to print you the order for blood work for HIV and hepatitis and things like that. And they're like, oh, I don't think I need that. I'm like, well, why not? I mean, they're okay with getting cultures for gonorrhea and chlamydia, but HIV is something that they think is still, I think, obsolete to them. They're immune to, or they're not going to get it. Won't happen to me. But on the flip side of that, there are good treatments now, where in the 90s,
sure,
everybody, I mean, this was almost like a death sentence if you got it. So I have several women who are living healthy, vibrant lives with HIV, undetected virus, because of the medical advancement. So I think that may be a part of why it's not such at the forefront of people's minds. But I think even as we grew up, we always thought, well, that's not going to ever happen to me. You know, I'm going to keep myself safe. So that's like the furthest thing from your mind, because it was always a subset of people who were the predominant people displaying this disease. They were so far different from what we are. We never thought it would trickle down to us. But Black women are extremely vulnerable still to HIV for a lot of different reasons, but most commonly because there's a huge population of bisexual Black men. And I think that just protecting yourself and knowing, you know, the best you can who you are with. If you, I mean, who, you know, I tell my patients, I don't care what you do, just be safe about it, you know, because you can't look at a penis. They don't talk. They're not gonna tell you where they've been. They don't talk, and they probably lie anyway, right? And they're not gonna tell you where they've been.
I want to meet
They're
the one that talks, that's for sure.
Right.
We'll all be in your office.
Right. So, you know, enjoy yourself, have fun, but just keep it safe. Keep it safe. So yeah, that's how I feel about it.
One point you made broadened the, I guess, definition of safe sex for me, because it's not just physical. I mean, it's not just your reproductive, which is when we used to talk about safe sex, it was about just don't get pregnant, but it's the physical, the mental, all of that is under that umbrella of safe sex. But going back to the reproductive old school discussion around safe sex, and not just safe sex, but, you know, being able to control having a baby or not having a baby. There's so many different means and methods now out there that you see all the commercials. What are some of these different contraceptives and the different options that are out there now for women who want to make sure they have control of their reproductive?
Okay, so yeah, I mean, they're you know, a vast array. And I'll start with, you know, if you could break it into hormonal versus non-hormonal. So we kind of have an idea of the non-hormonal, particularly condoms or any type of barriers. So barrier contraception has been around forever. So those are two non-hormonal, along with the Paragard IUD, and that's the 10-year one, or the copper IUD. So those are non-hormonal forms of birth control. And then of course you have sterilization. So that's just a whole different process there. But then you have hormonal contraception, and there's the traditional birth control pills, which is estrogen and progesterone. The estrogen portion works to help just regulate your cycles. The progesterone component is what prevents pregnancy by decreasing your ovulation. So things that work like that are the birth control pills. You have the Nuva ring, which is a ring-like device that goes in the vagina. You take it out every week and reinsert a new one 3 weeks in a row. And then they have the patch, and those are combination birth control. So you have the estrogen and progesterone to work together to control your cycle and to regulate your cycle and to prevent pregnancy. Then you have on the hormonal side, your long acting contraceptions, or your LARCs. And those are predominantly just progesterone, okay? They work in a different way. So two of those things are your Depo-Provera. People come in for the shot, and that's once every 3 months. And that works by suppressing your ovulation in general. It also thins the lining of your uterus. So a lot of women don't get a period when they are on that. Works very effectively, particularly my young girls who can't remember to take a pill or have problems taking pills. It works very well. And then the IUD, which is the Mirena IUD. And that is a device that has, in addition to the way an IUD works as far as blocking the opening of fallopian tubes in your uterus, and just being in the uterus kind of distorts the pattern of the sperm, it also has a little progesterone in the device that works to make the lining of your uterus really thin. And that often causes women to have nice, very light periods, if any at all. So those are your basic choices. Of course, you have like tubal sterilizations, and that can be done one or two different ways. Actually, really primarily one way now. We used to have a device called a Novasure that would um, you could do a tubal hysteroscopically through the vagina. I'm sorry, not a Novasure, Escher. You could do a tubal through the vagina versus surgically opening through the belly button. But now that's kind of off the market, so I wouldn't advise that. But you can do a tubal ligation. So those are your forms of contraception based on, you have to be honest with yourself. Say, look, I know I'm not going to be able to take this pill every day, so that's not going to be the best thing for you. Right now, I would say for even my younger girls who are, headed to college, my collegiates are requesting or asking for an IUD, which is something that years and years ago was like taboo for anybody that's never had a baby. But we have different sizes of them, and if you have a good doctor, one that would give you some anesthesia, local anesthesia as they insert it, like I would do. It was a pretty painless procedure to get it inserted. And you have birth control that's reliable for 3 to 5 years, depending on which one you chose. So it's no excuse for not getting pregnant, when you don't want to be.
Obviously, I was
Thank you for
asking
that.
for my sister friends out there, since I did bring up the menopause question, but
Thank you for that. So we've had a couple of questions that have just been put into our conversation on the Facebook group, various topics. So I'm going to do that came to mind. And one question came up about the pelvic floor. Can you explain what that is? And I believe the question was how to like strengthen it or to get it back. And then there's also been some discussions, not so much on our Facebook group, but in different conversations about different things like yoni steams and steaming the vagina and sitting on eggs and things of this nature. You can talk about those as well.
Okay, so let's talk about the pelvic floor first, okay? Because that other conversation could be really quick. So the pelvic floor is, think of your pelvis as like a hammock, okay? If you can see my hands, a hammock. And through this hammock, you have your bladder or your urethra, your vagina, and your rectum coming through, okay? Those muscles have been there supporting our pelvis strongly until something changes that causes that pressure in your pelvis to increase, primarily childbearing. So women who've had children, that pelvic floor relaxes. Say, for instance, you were a smoker and you coughed a lot, that pelvic floor relaxes. Women who ride horses, horseback riders, their pelvic floor relaxes. So anything that causes increased abdominal pressure pushes that pelvic floor musculature down. Now, this is one thing that we have the edge on as Black women. We don't have a lot of pelvic organ prolapse compared to Asian and Caucasian women. We just have a little bit better protoplasm. You can see that in our skin. Our collagen works just a little bit better. So rarely do I have a Black woman that's coming in with their uterus falling out. I mean, I have definitely seen it, but rarely. So with that said, though, you can still see some deficits in those muscles as we just age, and if you've had kids and things like that. The best way I tell people to help try to strengthen those muscles is a simple exercise called Kegels. Not sure if you heard about those. And so everybody can, say, yeah, I've heard about them and I know how to do them, but do you actually do them correctly? So this is how I tell my patients to do them. So you're on the toilet and you're urinating. Sit there and try to stop your stream over and over again, like on, off, on, off, on, off. And if you can completely stop your stream while you're urinating, then you know you're doing the Kegels correctly. And then once you've got that down, you can do your Kegels anywhere. You could be, in your meeting doing your Kegels, and nobody will know.
Kegling now.
You're Kegling now. Now, there are physical therapists that I work with who do specialize in pelvic reconstruction, pelvic floor exercises to help strengthen those muscles. And they use, again, like you were mentioning, the eggs and the cones and devices that you can insert into the vagina and try to hold them in. But it's really essentially doing the same thing as the Kegels would do.
Got it.
But those are ways to strengthen.
And what about the steams?
Steam, well, I mean, I think that's really, typically aren't harmful in general. Now, before I would have someone steam my vagina with anything, I need to know what it is that they're steaming it with. And then, talk to them about the process, because some women have gotten some significant burns from the steam. So be really careful, particularly, things that you get over the counter. Make sure, like you can get the stuff from Amazon, but what really are you putting in your vagina? Those things are important to know.
Right.
So I know there, particularly around town, there are a couple of places that have launched their businesses. And I think it's one of those things where, we talked about self-care. This could be, just as essential as a massage for yourself or getting a facial. But just be careful in terms of what you're actually steaming, because that could cause infection. And I've seen that before too. So.
Is it true that, this is what I think I know. I hope to God I'm right, because otherwise I might embarrass you. Anywho, let me just ask a question. Is it true that the vagina is a self-cleaning body part? Organ.
They oven, right?
Body parts.
Well, like your
I
oven.
think I said that because I'm pretty sure, like, I've asked you this question before, because I don't, and we kind of talk about ourselves on this, on our podcast, but I've never done any of the douching or cleansing or anything like that. And as far as you've always told me, I've gotten a good report back on the goings on down there. So what are your thoughts and considerations about that? And is it a self-cleaning organism? That's what I've always heard and understood.
Yeah, in general, okay. Yes, it is. It's a whole, it has its own ecosystem. That's when everything is good with your body, works very well. So you don't need to disrupt that with douching or all these sprays and things like that, because that actually does decrease your good bacteria that's in your vagina. And so in general, yes, it is a self-cleaning. If you did nothing and you were a menstruating woman, you will notice that your discharge will change before and after your period. And that's your body's way of kind of taking care of that and regrouping the ecosystem that's there. But that's not to say that things can't impact that, and you can get infections and you can have things out of balance. Hormones is one huge proponent of that. When our hormones change, and I don't mean necessarily cyclic change with the period, but particularly perimenopausal women. This is one thing I see a lot, that pH changes based on your hormones changing, and you have an overgrowth of what we call lactobacilli, and that causes what we call bacterial vaginosis. And that's easily treated. And I would say come in, have your doctor do an exam, look at it on the slide, and treat the right bacteria. I have patients that call and say, well, doctor, I have this, that, and the other. Can you send me this? Well, if you start treating whatever and not know what it is, you can actually do more harm than good, because bacteria can become resistant. So I would say as we grow older, particularly perimenopause women, need to really be mindful of their hormonal changes and know what's going on with their body. Once they identify, well, maybe my pH is off, I keep having these bacterial infections, I do recommend a probiotic. And they have, GNC has several lines of probiotics for women's health. Not the probiotic for the gut, because that's good too, but that's not going to help your vagina. So there's different probiotics for your general health as well.
Oh, okay.
That's one thing I would recommend, but the douching and the sprays and all those things are probably going to do more harm than good, and you'll be at your gynecologist's office trying to fix your vagina.
So shift one last question about the vaginal area, and then I want to shift real quickly before we close to breast health. Okay. What about vaginal dryness? Any is that something that you should go and see the doctor and to have the discussion about, or are there things that are on the shelves at your drugstore and Target that you can get to help with that if someone is experiencing that? And I think that's hormonal based. And so is that a part of the menopause? And can you talk to us about that?
Yeah, most of the time you don't see vaginal dryness in a premenopausal woman.
Okay.
If you do, then you really need to be concerned about something else, more like dermatologic issues down there. So that's rare. So most of the time you see issues with vaginal dryness. These are menopausal women when that estrogen leaves the vaginal mucosa. And obviously this can be problematic with intercourse or just in life in general. You've been used to having things feel a certain way and now all of a sudden they don't. That's when I go into my doctor and just say, look, this is what's going on. It's an easy way to check. You just have the doctor swab your vagina and look at the epithelial cells there and see if, there's some noted changes there. Say, yeah, the pH may be off and the epithelial cells are changing, and or check some hormones to see if you are, at a menopausal level, and look at the vaginal tissue itself because it can show signs of atrophy or thinning. In those cases, vaginal hormones could help. Okay. I'm not a big proponent of oral hormone replacement therapy, but sometimes women need a little bit of extra estrogen in the vagina, and that does help with reversing actually the effects of estrogen decline in the vagina. So if you're experiencing severe symptoms, I would consider that. But if you're just having problems with intercourse, that could be helped with over-the-counter things, that would be perfect too. So the silicone, hold on just a second.
Sure.
The silicone-based or the water-based, like KY gel, works very well as well. So,
okay. This is fascinating. We're gonna have to bring you back. Okay, so just quickly, because this is important for us.
Oh, wait, back to that. There's
no,
one that I had a drug rep bring them to me, little samples, and they're called Uber Lube.
Okay.
And, and you can go online and get this, and supposedly it works very well.
Erica, are you taking notes?
Yeah.
I'm writing down Uber Lube. Yes. Hey. These things are good to know.
Good to know.
Okay. So, okay, great. Thank you for that. Uber Lube. You can, we said it 3 times. Maybe they'll send us a sponsorship or something.
Maybe so.
Right.
KY, we did recommend KY. We dropped a few actual brand names in this conversation.
We did.
So that's great. So let's shift to breast health and our breast health care. And you could talk to us about the importance of self-exams, when we should do them, how often, and any little tips you have on reminding how we can remember to do it, and what we should do if we feel something different.
Okay, so I think our best defense against breast cancer initially in the short scope is to do your own self-breast exams. And typically, if you're a menstruating woman, I recommend doing this 5 days after your period's over, okay? Because that's when your breasts are a lot less glandular, very supple, and the glands that were there when you were menstruating are gone. If you feel something in one breast, and this is how I instruct women to do it in the shower when things are nice and soapy and you can feel a lot better. And you just go take your 3 fingers and go around your breast like this in the shower and up under your arms, okay? Up under your armpits, that's where lymph nodes are. So you go around the circumference of your breast and you notice any masses, even the size of a pea. If you notice it's in one breast, check to see if it's in the same place in the other breast. If it is, chances are it's something that's been there or something that's supposed to be there. But if it's unilateral, if it's only on one breast, notice it, reevaluate it again in a week. If it's still there, that's when you need to call your doctor. If your doctor says, I don't feel anything, and you sit there in front of your doctor and say, I still feel it, and your doctor says, well, I don't feel anything, you say, I still feel it, can I get an ultrasound? That's when you open your mouth and you say, I need you to get me an ultrasound. so I can see, I feel something in my breast. If you really feel something, don't stop until you know what it is or what it's not. Okay, because you know your breast better than I'm going to know your breast. And I can, depending on the angle or way I'm examining, I may or may not feel what you feel. So, you know, when women come in and say they have a breast mass, if I feel it or don't, you know, if I really don't feel it and they are persistent about it, I get a breast ultrasound. It's very simple. It's very easy to do. Now, if you're 45 or older, then 40 or older, you can get a mammogram. Your health insurance should pay for that. And that's a screening test. It's not the most comfortable thing. It's pretty uncomfortable, to be honest with you. It's pretty darn uncomfortable. But it only lasts for a few seconds. And it's our best screening tool for breast cancer. And as we know, early detection saves lives. So those are two things: your self breast exam and getting your mammogram annually after you turn 40 are your best defenses. Now, here's another thing I think is very important: is talk to people in your family, know your family history, and ask them, particularly the women in your family, about cancer in general, not just breast cancer. There's what we call BRCA gene cancers related to this BRCA gene 1 and 2 that have more than just breast cancer. So breast, ovarian, uterine, colon, prostate cancer. Yeah, those are the main ones in this umbrella. So talk to your family about the recurrence of these types of cancers, because if you do have this, then you can get genetic testing done. Okay, so say you go to your doctor and they ask about your family history and you say, oh yeah, well, my great grandma had breast cancer. Well, that's not really a first degree relative. But then you say, well, my mom had uterine and my sister had ovarian. Well, that can put you in a place where you can get free, you know, genetic testing by your insurance. And that's very important. Okay, so talk to, you know, make sure your family, you know, your family history as best you can. And then understand that there are genetic tests that can help with the early detection and diagnosis.
Joy, does that only apply to the women in your family, or do you also need to inquire about the men in your family?
You should inquire about the men in your family too, as well, particularly for prostate and colon cancer. And if you have like your dad, a first dad or brother that has breast cancer, that actually puts you at pretty high risk of getting breast cancer as well. So definitely put that on, you know, make sure you ask about those things too.
Great. Well, this has been a fascinating conversation. We are so happy that you were able to join us and that you took this time out of your busy day and late into the evening, because we're recording this in the evening today. So we really appreciate, we hope that we can get you back, you know, maybe later on in the year to do another, because there's lots and lots of questions that we have about our health as Black women that you could probably help us out with. So hopefully you've enjoyed your time with us.
I have, thoroughly. It's been nice.
Thank you.
This is Dr. Joi Robinson Tidmore. She, as I stated at the top, is with Lake Health. So if you are in need of a fantastic OBGYN, I'm sure she's still accepting patients. So you can reach out to her and she'll take good care of you. She's on time, she's kind, and very informative. And I'll actually be seeing her in 2 days on Thursday.
Oh, wow. So. No, I've thoroughly enjoyed it. Thank you, ladies, and the best of health for you guys. I'm available if you want me to come back. I'd love to do so.
Thank you.
Thank you so much.
Thank you, Joy.
Okay, thank you. Thank you, Michelle.